Janet Mills chose someone she knows well to be Maine's first director of opioid response. As head of the Maine Medical Association, Gordon Smith has been a leading voice on health issues at the State House for years. He's also been involved in the opioid fight, working to convince doctors to cut the number of prescriptions for legal opioids. He says Maine has made a lot of progress.
We're not out of the woods on that yet.
Now, Smith will have to work with all sides to expand Maine's efforts to stop the flow of drugs and help those addicted while they can be helped.
I've heard from so many people, including the state trooper in the Bangor area. He and his wife lost 2 adult sons to drug overdose.
Gordon Smith says he plans to get going right away to deal with many pieces of the opioid drug problem. But he says for Maine right now, the biggest need is drug treatment. That will include hospitals, detox facilities, inpatient and outpatient treatment. Smith says Maine simply needs more.
We don't have enough places in the state where there's rapid access to treatment. People who have been suffering from a substance use disorder for 5 years, 10 years, 15 years, you finally get them to the place where they acknowledge, I don't want to live like this, I'm ready to try recovery, and then there's no place for them.
The governor said she also wants more resources to help people get into recovery, especially those who are saved by Narcan but then go back to using.
It's about stopping that very revolving door, and there are ways we're going to be able to do that, working with the hospitals, with the medical community.
Smith said he and the governor have been studying programs in other states, including ones that make sure every person saved with Narcan at least gets a number to call.
In some places in this country, you call that number and in 15 minutes they can get you into treatment. We got a long ways to go, but there is no question but what we can save lives if we can do the things that other states have been successful in doing.
They say it will take money and commitment from the legislature and from the public, who all agree the drug deaths have to be stopped. In Augusta, Don Kerrigan, News Center, Maine.